Hi, it's Dr. Jeff with Neuro Re-Set. I'm going to give you a brief demonstration of what our Neuro Re-Set may look like for someone who are treated for complex regional pain syndromes, chronic pain, some type of nerve damage. The purpose of this is to reset the nervous system, okay? Enhance the communication between the brain and the rest of the body, the joints and the muscles. So this would be a neuromuscular reset using the Phoenix Waveform. And basically what we're doing is, this is for someone, like I said, who's got agility problems, motor coordination problems, muscle atrophy, muscle weakness, muscle instability or lack of coordination, or chronic pain. So what we're doing is, again, we're trying to reestablish that brain-muscle connection. And also what we're trying to do is lengthen those muscles and get those muscles activated. So obviously it's specific to your specific situation, but this is a good starting point. So I'm just going to demonstrate this on one side just for time's sake. So we're going to put one pad on the bottom of the foot, another pad outside in the ankle here. We're using the Phoenix Waveform. Only you do this if you have the Phoenix Waveform. You can use it if you have a Therastem or an arc wave. You can use these protocols for that also. So I'm using a 500 contractions a second. So we're getting 500 contractions a second, or 500 impulses, neurological impulses, to the bottom of the foot and the ankle. So basically what we're doing is we're starting, this is going to be a lower body, and this would be a lower body neuromuscular reset. And what we're doing is basically starting at the bottom of the foot and working up to the back, and we're activating all the muscles and the joints and getting that feedback back up to the brain. So now I have a pad on the bottom of my foot and outside of the leg, and the exercise or movement progression is going to depend on your specific injury, chronic pain, what you're able to do. So a lot of this just might be passive, just sit in the chair right now, and then you might move up to some of the actual walk around the clinic doing some activities. So I'm just going to be briefly here. So we got it, Phoenix Waveform on the bottom of the foot, and then we might have the client do some flexion, extension, back and forth. Maybe all depending on the condition and the movement patterns, 5 to 10 reps. If you have bad movement patterns and that's the area you want to focus on, we would spend more time doing that. So just flex, extend, kind of calf presses. Some people might just do this totally in the chair. Others people will advance up. We're going to do some ankle rolls, outside, inside. And we like to have them try to stand up and open up that front ankle joint. These are like some Z Health exercises. If you look up Z Health mobility drills, moving the inside, open up the inside of the ankle, open up the outside of the ankle, press pause, take the pad off the calf, off the ankle, up to the calf, off the foot, and to the anterior tip. So now I unpress pause. So I got it on the tibialis anterior and the calf. And again, some people might just be sitting in the chair. Ankle presses, press up, heel walk. So maybe toe press, walking on the heel if you're able to do this. Pause. Now we're going up to the knee. On each side of the knee. Again, 500 pulses per second going into the joint. Just simple knee circles both ways. And a little pendulum. Back like that. Pause. Going on the calf and the hamstrings. So now we got it on the calf and the hamstrings. Unpress pause. like having people toes up and then try to go down as far as they can. Weights are nice to help you pull it down a little further. Getting some calf presses. And now you might work up to this, but this would be like some butt kickers. So we're activating that hamstring. Pause it. Now we're going to the quad and the glute. Quad and the glute. Unpause. So now we're sitting with the quad and the glute. So here, it might just be walking in place. You might be able to get to, I lost the lead here. Plug that back in. Sometimes when we do this, and we do have the plugs are plugged into this, and it's maybe good to put a little piece of tape this lead up right here, so that way if you get caught, it's not going to pop off like it just did on me. So you might have someone do just that, walking in place like that, and then progress them to sit up with some assistance. Then the next progression might be taking them deep down, and then eventually, hopefully, get in where I can do some jumps. Obviously, I have to progress much more to that level. So now what we're going to do is we're going to take a splicer here. So a splicer takes one lead and turns into two. And again, we would be doing this on both sides. So I got a splicer here. And now I'm going to put, this is probably one of my more favorite setups. People really love this. Over the hip flexor here. And then we're going over the back. So we can lead here, hip flexor and back. Another splicer. And we're going over the glute medius, which is a muscle that frequently gets inhibited. And the gluteus maximus. So now out of one channel, I got hip flexor and back, glute medius, glute maximus. And again, it might, with this setup, we might just sit off with some walking, progressing, some getting out of the chair. Out of the chair to some deeper squats. What we're also doing on this one is we're going to loosen up the hip flexor. This is great because you're feeling this entire hip area and back. And just some mobility like this. And then circles. So if someone might not be able to stand and do the circles, that's fine. They can sit here and do some circles this way. So we basically, one side, the other side, try to do side circles, and then some back circles. And then we're going to do some lumbar circles. Get it drop. And just go like that. And just when I did that, my whole back just released and popped. So great. And back. So in that amount of time, we basically started in the bottom of the foot, went up to the hip. We activated all the muscles, the major muscles of the lower extremity. We've gained stimulus, proprioceptive stimulus to the joints. And that could be a treatment on its own, or now this could be the session to go, you do this before you actually do some exercises. Or this might be now where we have patients walk around. Since the Phoenix Waveform is so small and powerful, we can just put it in a pocket, walk around with it throughout the day. So that, again, was a Neuro Re-Set. Look at our neural recoveries, and then also the neural strength training. If you have any questions, just drop me a line and try to help you out.